Hi, Michelle. How are you?
I'm doing great. Thank you so much for having me.
I'm excited to have you on this episode. This is going to be a great conversation. I already know because I don't know, I have a lot of questions. We messaged a little bit back and forth in LinkedIn. So, for fear of going out of order, let me just start from the beginning and have you just tell us a little bit about yourself.
Yeah, sure. Yeah, so I'm Michelle Bangen. I use she and her pronouns. I'm located in Corvallis, Oregon, and I've been a public health prevention practitioner for about 15 years, where I've really had the opportunity to work in a bunch of different topical areas, anywhere from like pre-K to higher ed to county government. So have really had a chance to kind of see it all. And in the last, I think it's been about 3 years now, decided to go out on my own and become a public health entrepreneur. So now I'm also co-founder of Incite Agency for Change.
That's the part that I'm super giddy about learning. But before we go straight there, so many things I want to ask you about. Um, I would love to hear the journey. You know how you got here. So, one of my favorite questions when I'm interviewing and having leading these conversations is to kind of find out where it all started. So, when did you first learn about public health as a career?
Yeah, so it actually happens to be, I can pinpoint it for you. My senior year of my undergraduate program, I was in a kinesiology program, and I happened to just take a community health class. And this was really my first glimpse into the world of public health. To that point, a lot of my education had really been focused on helping individuals. And for me, learning about behavior change theories, that was fascinating, but it was community health planning that really sort of got my wheels turning. I liked the idea of having a positive impact on, more than one person at a time. So after, one semester, this one community health class and an awesome professor who I still stay in touch with today, I decided to switch my plans of going to like a PT school into a public health program. So I was really just excited to learn about upstream prevention, social determinants of health, community engagement strategies. And I had a graduate assistantship in the Student Wellness Center, and I never looked back. That was my first, glimpse into actual real life community health. And I loved it. So I've been doing it ever since.
Oh, I love that. I love that story. So, so you completed your undergrad in kinesiology. I guess you're too far into it to switch, of course, at that
Yeah,
point.
yeah. So my undergrad, it's a bachelor's of science, right?
Right.
In exercise science is, a pretty basic degree. I was planning to go for further, education down the kinesiology route, and I just fell in love with community population health, and I think I still have my little burgundy colored, like green and cruder, pre-seed proceed model book. That was like my very first. It's a keepsake at this point.
Right. Oh, that's really great. But, there's a lot from your undergrad that definitely applies. I mean, it's not like it's anything lost or wasted at any means.
No.
Um, so I love that. Is there a particular public health problem that you're most focused on or passionate about, or maybe a population or a particular issue that captures your heart now?
Yeah, a couple things. A large portion of my career has really been focused on gender based violence, sexual violence prevention, primarily in higher education. And so that's really where I started to see the intersecting root causes of a lot of different, what we would call wicked problems,
Hmm.
the vexing social issues that really are difficult to untangle. And so after leaving higher education a few years back, I took a position doing mental health promotion and suicide prevention. And I was really drawn to the capacity building in the community. And it was yet again one of those, wicked problems that had some really similar underlying challenges. And so at this point in time, my work is primarily focused on suicide prevention, which I get to do alongside my business partner, Charlette Lumby. who she and I actually met in a training for trainers for an evidence-based suicide prevention program. And not a few months later, we were talking about starting a business together. So that's kind of how Incite was born.
Wow. Oh my goodness, that's very and that's in there's a lot of energy around that, and we're going to dive into your business a little bit more. Let's go a little bit further. Like, tell me more. Are you focused primarily on suicide prevention now, or solely on suicide prevention with your business, or is there more? Tell me more about what you do and who you target.
Yeah, so at this point, that's what we've been doing. I have, again, that background in sexual violence prevention. So have that as sort of an offering and something that I can help communities think about, policies around gender-based violence and that kind of stuff. But the work that we've been getting, there's just such a need for mental health and suicide prevention that seems to really be what people are asking for. And so our primary customer at this point has been agencies like public health departments or entire school districts. But we're starting to work more with like police departments and first responders. And we're really eager to get more connected within the medical field. Because we know that folks who are struggling with suicide, they show up in all these different places, and nobody's, really received formal training on how to be helpful in those situations. And so that's really been our primary audience. We do also really just want to make sure that anybody anywhere is able to have a conversation around mental health and suicide. And so we also try to get, trainings that are open to the general public out there as well. So working with community coalitions or other community groups to try to make sure that people sort of on the ground where we live, work, play, pray, all the things that people can notice if someone's struggling.
This is interesting. So, you mentioned schools and then, other agencies. Is there a target for different age groups, or are you covering all age groups in your services?
Yeah, so we can cover all age groups. Something we know about suicide is it's a lifespan problem. It's sadly getting, I think, younger and younger that we're starting to notice these issues pop up. And so, at least here in the state of Oregon, we've done a lot of work around trying to get schools more equipped to provide support to their students to notice if people are struggling. And so we essentially have entire school districts who are saying, every one of our employees needs to have some level of suicide prevention training. We need the bus driver. We need the lunch person. We need, just the administrator who you say hi to and you see their face every day. We need those people to be able to notice things. And so it really ranges from like, we can train 12-year-olds. We've got some programs that are appropriate for a 12-year-old audience, all the way up to, in-depth intervention level trainings that would be more geared towards, a professional helper.
That is interesting, fascinating. I actually have a client in mind I'm working with right now. I'm working with a pediatrician who has been, she's been a pediatrician for I don't know how many years, at least 15, 20 years, probably longer
Mm-hmm.
than that. And she says she's passionate about meeting, like bringing the resources and more like mental health resources to families with young children before the point of crisis, because she's
Right.
treated so many at that point of crisis. And it's such a delicate walk when they're already at a crisis point. We're talking about young children, and specifically Black and Brown and children in rural communities.
Yeah.
So everything you're talking about is making me think about her and make sure that I share this episode with her.
Yeah.
Um,
Please do.
so tell me a bit about, make sure I understand services, because someone
Mm-hmm.
listening may be thinking, oh, wow, I really need to connect with her, which I will definitely make sure they get all that at the end of the episode. But um, tell me a little bit more about how you work with the school districts or these organizations, the churches, the agencies that you work with. Is it all specifically training? But just tell me more about that.
So it's a wide range of things. I mean, I've worked on anything from like a public health marketing campaign that really tries to reduce stigma, right?
Mm-hmm.
All the way into training and capacity building within agencies. One of the things that we love doing the most is really helping organizations or entire communities think about how to build a network of safety. And the way we think about that is, if you have a small portion of individuals, maybe like 5% of your population, who is trained at, a really in-depth intervention level, you have a portion of your community, maybe 15% or so, that can be good gatekeepers with connecting skills. And then if most of your community, maybe 80%, we would love to see, has some sort of basic knowledge and awareness, it really makes it so that if there's somebody in your community struggling with suicide, the likelihood of them like bumping into somebody who can be helpful is really, really good. So we work with agencies and communities to sort of identify, who are these people that would be well equipped to notice people who are struggling? What level of training do they need for the type of interactions that they may find themselves in? And then getting them sort of that wide range of trainings that are available.
Right. Oh, now as we're talking, I'm thinking of so many possibilities. I recently, what comes to mind is just through interaction with family members. We've had loss of loved ones, elderly family members, and realizing that there's such a need for that kind of support within elderly communities, because we've got, people making certain comments or red flags in my mind, but then it's like no one else is noticing that. And it's like, what do you do and how do you address it? Have you
Right.
noticed, or have you worked in that kind of situation?
Yeah, in fact, we are fortunate to have just received a contract with our state to think about how we can get training and support out to providers in rural Oregon and those who serve elderly populations. Because it's the very thing. People aren't necessarily noticing it or thinking that, that person could be actually considering suicide. They're just talking about, end of life types of
Mm-hmm.
things.
Right.
And so being able to equip people with those skills to notice and recognize, and also think about like means and methods, right? Like what are lethal means, especially in some rural locations that folks have access to, and, wanting to make sure that people can be safe if they're in a suicide crisis.
Yeah. Yeah. Really important work. I'm just blown away, and I'm looking forward to being able to make sure we share all of your resources. Again on the show notes page, which I'll tell everyone about pretty shortly here. Let's talk a little bit about how you got started. That's yeah. How did, I know you guys bumped into each other in a conference and kind of had the idea, but tell me a little bit more about that.
Yeah, so we both were connected with our Mid Valley Suicide Prevention Coalition, who paid for us both and some other trainers to go to a T for T, training for trainers, for this really basically the most in depth, robust, gold standard suicide prevention training out there. It's called ASSIST, Applied Suicide Intervention Skills Training. We met at this training. We hit it off. We sat together the whole week. We had so much in common. And even though we had really different professional backgrounds, we brought like a lot of the same passion and knowledge and skills that we just, like I said, we just really hit it off. So we trained together a couple times. And then, funny enough, we had Christmas break, went away, came home from the holidays, wanted to just kind of have a catch up, a girlfriend's dinner, whatever. And we both actually went to that dinner with the intention of pitching to the other one, we need to do a business together. We need to get out there and do capacity building in our community. We both have the same kind of energy and drive to do that. So, how can we make it happen? And by the end of that conversation, we had the beginnings of a business plan. And we really worked to kind of get that out there as quickly as we could. Um, Interestingly enough, though, so that was in February of 2020. And Assist happens to be an in-person only training. So I wouldn't recommend, starting a business at the beginning of a global pandemic based on something that you're supposed to do in person. So we really spent a lot of time our first year just kind of like relationship building, and showing up to things in the community. And here we are, about 3 years later, and so much has come back to us, from those relationships and just work that we're able to contribute to across the state.
Oh, that's a great story. A lot of inspiration, a lot of synergy. And you messaged me when you met when we were engaging on LinkedIn. You mentioned the expo. So had you
Yes.
attended the expo in that year?
I attended the expo the year prior to that.
Ah,
So it must have been probably only a few months really before coming to, Charlotte, my business partner, with this idea. And it really was a huge springboard for me. It's something I had been thinking about wanting to do for a while, but just not necessarily feeling like I had the tools or maybe, examples of other people in the field who were doing similar work. I mean, they don't teach you how to be an entrepreneur in public health school.
right.
So I don't even know how I came across you to begin with. It probably was on LinkedIn, and I saw your expo, which looked like, a stellar lineup, and it was. I came, I attended as many of the sessions as I could. I'm out here on the West Coast, so I think you all started a little bit early for me for some of them. Um, but I was really inspired, and I kind of got a little bit more confidence about, I think I could pull this off. And I know there's a group of, I mean, pardon my language, but kick-ass women out there in particular who are doing, exactly what we want to do in public health and trying to support our communities. So it was just a really
Yeah.
exciting opportunity, and definitely was kind of a fueling point for me.
Oh yeah. Yeah, you this is interesting because in your description of the way the expo flowed in that year, that lets me know it was definitely one of the earlier iterations of the expo because we did start with a full day of live events, and that was exhausting for me. It was energizing but so exhausting. But I remember that there was someone else who she took the day off. She sat there with me all day and she just attended live and launched her business. She was so inspired shortly after that. It's great to know that which was always the idea when I started the expo, and even to this day, the version that we have now, it is about inspiration. Inspiring because a lot of us are, especially after you've been in your field for a little while, you've worked for a little while, you're really aware of some of the gaps or
Mhm.
the deficiencies that we have, and you have some ideas about how you'd like to address those or how you do things differently, but it usually doesn't go much further than that. So it's nice to know that this inspiration from bringing these people together that I meet over time is
Yeah.
really, you're a great example of that.
Yeah, I love that. I mean, it was really, I think, one of the scariest things about leaving some place like higher education or, a public health department is it really does create structure for you to be able to do your work. There's a lot of bureaucracy and pieces that, would be really nice to get around, which is, part of what pushes you, I think, for me, pushed me a little bit to go out on my own. But it's difficult to think about how to do our work outside of those systems sometimes. Like, you're not
Yeah.
well connected in a lot of ways. Even, you can live in a community for 5 years, and if all you did was work at a university like I did, it's really hard to see yourself being plugged in other places.
Yeah.
So I think that was definitely a big hurdle, but being able to see other people, like how they've navigated, what niches they end up in. It's just really inspiring, and it sparks ideas. It makes you think, well, where could I be if I, if I built the right relationships, made the right connections, where could I be?
Yeah, that's a great point. I also find that I'm I've partnered with public health organizations, government organizations that where I'm able to have a greater impact and fill a need as a consultant in a way that that never would have been possible as an employee.
Yeah, it's so true. I've gone on recording at a national conference where folks are like, how on earth are you able to do, this and that and the other? And I said, that's partially why you work for yourself sometimes, because you get to do what you want.
Yeah.
And that's exactly right. Is like, we can support some of those agencies in ways that they were limited to do on their own. And we find that actually really regularly, That's why, a public health department is one of our biggest contracts. Even though I couldn't do that kind of work while I was there, they are happy to have me come back and do that kind of work as a consultant.
Yeah, exactly. I love that. Um, this is really exciting and very energizing. Well, I could probably talk about this all day long. I want to kind of connect the dots. I like to phrase this part of the conversation because we have a variety of people listening to this podcast. We have students, professionals of all different levels. We have other entrepreneurs. We have folks that are outside of public health that are curious about public health and tune in to try to figure out, well, what is this all about?
Mhm.
So I would like to start connecting the dots a little bit in terms of the meaning of public health for you and the meaning of epidemiology and in your own words, not looking for a textbook kind of a definition, but I think it helps when you connect the dots to what you do. It helps people that are listening to get a more a practical understanding. So
Yeah.
my kind of first of these two questions for you is, how has the understanding of public health helped you better serve your community and have a greater impact on the industry?
Yeah. Well, in working around topics that are so complicated, like suicide, substance use, all types of violence, I find that just by being able to treat those issues as public health problems really allows us to use, proven public health strategies to solve them. It really gives us structures and frameworks that help us have the biggest impact in our community. So, for example, using strategies like community-based participatory approaches, that ensures that programs and services meet the needs of the intended audience, and that, those programs and services are much more likely to have uptake within the community because they were part of creating them. Or, understanding social determinants of health really helps us sort of clearly see what some of those root causes and connections that underlie a lot of different public health concerns. And then when we start addressing those common root causes, risk factors, protective factors, then we're really working on improving community health across the board.
That's really well said. Yeah. Now, in that same vein, um, think about epidemiology and how does the understanding of epidemiology help you better serve your communities and have a greater impact?
Yeah. Well, epidemiology is essential, right, for us to understand the different factors, maybe related to who's dying by suicide, how they're dying. And that really helps us inform, both community prevention strategies as well as individual intervention strategies. It also can give us clues about who may be well positioned to notice if somebody is struggling. And then we know who we need to get out there and equip with, life-saving intervention skills. And it's also just really important for us to be able to learn from the research which strategies might be most effective. Suicide research is relatively young compared to many other public health topics. And so we're always learning, and we always need to, be looking to the data to inform where we're going next.
Yeah. Wow. Really well said. I think it's interesting and just, I'm sure you can relate to this. When you start your business, you start with this idea and this passion for change, and you don't know all the details and the nuances, and you have to fill in the gaps later. So to hear you articulate that and to put that into context, that's not something you could have done starting out with the business, right?
It's something that you've done bits and pieces of, right?
Right.
In all the other jobs and roles that you've had. And then when you start your own business, you really try to pull all of those pieces together. And it's kind of magical when it
Yeah.
happens.
Yeah. Yeah. I definitely understand. Very well said. I'm enjoying this conversation and really getting to know you and appreciate your time. I have one more question and then we'll wrap up.
Yeah.
Again, mentioning that I have such a diverse audience of listeners of the podcast, which I absolutely adore. Um, is there any bit of advice or a tip that you would share with someone listening who may be also interested in doing some similar work?
Yeah, I think this is pretty applicable across the board, but my recommendation is to build relationships, authentic, meaningful relationships. That's really been a huge key for success in all of my different, previous prevention roles, and especially now as an entrepreneur. Um, Sometimes that's as simple as offering, your talents with no expectations, or showing up to something and just showing interest in a community or a program or a service. Here in Oregon, maybe that is bonding over coffee or a microbrew. But in any case, really, these things give folks a chance to know who you are, what you care about, and then they may think of you, when mutual interests or collaborative opportunities arise. And I will say something that we've had to push back against a lot as entrepreneurs is that just because we're self employed doesn't mean we see this work as competition. We know that working in public health and in suicide prevention, like there is enough need to go around.
Yes.
And we know we can accomplish more together. So by building these strong relationships with our partners, when we say that, people believe us now, which is really, really nice. We don't have to come to the table feeling like people will see us as, trying to be competitive in some way.
That is so well said. Literally, I batch record my interviews for the podcast. So I literally had an interview with someone this morning, and we had almost word for word that same thing. We're better together. We're stronger together.
Yes.
It's so important. I absolutely embrace that concept, and that's how I am. There's more than enough to go around. There's no competition in this industry.
Yeah.
We are absolutely better together. So
We all came to this work to help people, right? And to help
yes.
communities. And so if we can just stick to our roots and, why we're here,
Yes.
then the rest of it all can sort of play out.
Yes, absolutely. Well, I'm going to be sharing the links to connect with you in the show notes, and I'll tell everyone in just a moment how to get the show notes. So, if someone's listening,
Yeah.
what's the best way for listeners to connect with you?
I'd say the best way to connect is head over to our website, inciteforchange.org. Something they don't teach you in public health school is how to design a website. And we're very proud to have built our own. So we would love to, have you come on over and visit us there.
Very nice. Definitely add the links to the show notes. But I wanted to share that with anyone listening who's just really anxious to just jump on over there. Well, thank you, Michelle. This has been really nice to chat with you and to get to know you better. And I wish you all the best as you continue to do this important work.
Thank you. And thank you so much for having me and everything you do to support entrepreneurs in public health.
Oh, my pleasure.